Hi, this is AJ Peterson, Vice President and General Manager at Netsmart Technologies. Here to talk to you today about considerations for a new virtual world. So as we have been making the shift over the past two and a half months from face-to-face encounters and visits, whether that's within our workplace, a business, or as provider organizations have been making the shift to virtual care in order to address the impact that COVID-19 has been having across our country. It's been important to see that the use of technology tools to enable that shift have been implemented in order to ensure that the care and services of individuals continue to be delivered during this time of crisis. So telehealth has been a vehicle that we've seen take off in the past 2.5 to 3 months now, as it relates to clinical care services that are being delivered more broadly than may have been done before. More organizations overnight have essentially virtualized their entire practice. So I'm going to talk a little bit about some of the use cases that I have seen through our clients here at Netsmart taken on as it relates to telehealth, and then get into some of the kind of the best practices and observations more nationally of how the rollout of telehealth has been going, and then even taking a look at one of our clients that have been in the epicenter in New York City of COVID-19 and how they have adapted quickly in order to ensure that their organization is prepared for the new virtual care world. So first, when we think of telehealth, we look at the areas in which provider organizations can virtually enable care and services to be delivered by their own providers. So essentially taking a set of providers and individuals and putting them onto a common telehealth platform that can then make their services available to individuals that may be at home, maybe at other facilities, and looking at that from both an on-demand and scheduled appointment use case. So as now visits are being delivered virtually, how do I adjust my scheduling processes in order to now enable the telehealth visits versus the face-to-face? Also, as I'm looking to open my door widely from a telehealth perspective, how do I enable on-demand services? So if I have an individual client or consumer that has a behavioral health crisis or need, how do I enable my provider network in order to serve that individual when they need services which may be outside of a scheduled appointment? And this also allows for providers to see more individuals as they're no longer being restricted to geographic boundaries within an area, a service area for an organization. And really, this is driving at how do we better manage the capacity that our providers have today in order to serve their individuals, also while driving up the overall outcomes as a result of those services through the quality of the visit, compliance from the individual, and then ultimately driving down the cost. So a number of different use cases have been really coming to light over the past couple of months. One is the idea of an online care group. So if I have providers that are delivering services, but I may not have enough or may not have the right provider type, we've been seeing networks of providers really emerging to make their services available to organizations virtually. So when we think about psychiatry as a shortage in this country, how do I, as a community mental health center, for example, access a network of psychiatrists in order to deliver services when I may have trouble recruiting, finding, and even keeping psychiatrists? So we've been seeing the psychiatric networks that have been aligning their services directly to the community mental health centers in order to offset some of the provider shortages that they have been experiencing to ensure that the psychiatric services, medication management, are continually being delivered to individuals that they are serving. We've also seen a dramatic impact of COVID-19 to skilled nursing facilities. So as providers have no longer been able to enter into those facilities, unfortunately, loved ones are not either. And it's really been causing a lot of strain on the residents inside of these skilled nursing facilities that we've been seeing a growing number of individuals having behavioral health and psychiatry needs. And the providers aren't necessarily able to enter into those skilled nursing facilities in order to care for those individuals. So the use of telehealth has really allowed and enabled that provider set of psychiatry to be able to deliver the critical services to those residents inside of the skilled nursing facilities during this lockdown time that they're having inside of those residences in order to protect those individuals. So we're seeing a growing demand and need for behavioral health services to be delivered inside of skilled nursing facilities and even into other care continuum in the post-acute on assisted living and even independent living. So the use of telehealth through mobile cart technology and enabling a provider network externally is really helping drive a level of care that these residents need from a behavioral health perspective. Also, there's been a very strong push to keep the emergency departments and hospitals clear of all non-COVID-19 cases, the use of telehealth is becoming more prevalent inside of those emergency departments as individuals that are presenting in a crisis, in possibly an overdose situation, allow for those nurses and physicians in the ED to have ready access to the necessary and required psychiatric consultations that are absolutely needed in order to triage, assess, and to make a clinical recommendation for that person out of the emergency department and directly into the appropriate level of care. One, freeing up that bed inside of that emergency department for individuals that are coming in from COVID-19. But even more importantly, I would say, is ensuring that individuals are receiving the care that they need at the appropriate care setting and in an appropriate manner. So having the ability for those nurses to access psychiatrists on demand through a virtual care network is absolutely critical in order to ensure those individuals are receiving the care they need, and then transition them through a warm handoff to the appropriate community care center for ongoing care to treat their behavioral health or even substance use need. And then very similarly on the opioid use, there's specific protocols that hospitals have in place as relates to screening individuals for opioid use, and then allowing and plugging in a telehealth portion of that program into that protocol so that individuals in the ED can go through the assessment. They may do a urine analysis, and then the ED uses that technology to be able to access the psychiatrist or the substance use provider on demand in order to complete the appropriate evaluation inside of the emergency department or even into the intensive care unit, and then starting to deliver the treatment plan for opioid use, and then ensuring that the providers outside of the emergency department are able to pick up the case and pick up the ongoing care and get them into their opioid use or maybe an MAT program. So again, using telehealth as a way to enable the providers inside of the emergency room in crisis, treating an individual in crisis, to be able to access the necessary providers in order to quickly assess and treat that individual and get them into the appropriate care setting. We've also been seeing the use of telehealth with law enforcement. So whether it is a crisis intervention team or a mental health first responder program where clinicians are working directly with law enforcement officers to help them when they engage an individual out in the community that may be suffering from a behavioral health crisis. So instead of having that officer either have a clinician ride along to where they are, which isn't necessarily the most efficient way to use the clinician's time, or using a telephone in order to access a clinician on demand, rather using telehealth so that officer can then bring a clinician in and do a virtual face-to-face engagement with the individual in crisis. This has been a highly effective way of leveraging clinicians' time and managing a broad area to where they can't anticipate when an officer needs help, but when they do, they're able to come in via telehealth mobile application in order to help that officer and ultimately help that individual in crisis, stabilize them. And the idea is to not bring them to jail or to the emergency department, but rather if there was a crisis center or there was a facility in the area, maybe a community mental health center, that would be able to see that individual immediately as an alternative to a high acuity, high cost, and not necessarily the best place for an individual with a behavioral health crisis to go, i.e. a jail or an emergency department. So the use of telehealth across law enforcement officers and community mental health clinicians in order to better serve individuals in the community who may be in a crisis. Remote patient monitoring, if we've been tracking the FCC funding initiative, there's been a lot of the awardees that have been standing up remote patient monitoring programs. So this is really meant to drive a level of care and a level of ongoing monitoring based on the acuity level of the person, so that I, as a provider clinician, can have insight into how an individual is doing when they're in their home, and have leading indicators so that I can intervene appropriately with the appropriate intervention at the appropriate time, so that we can head off any exacerbation of symptoms in an individual having to default to go to emergency department. So whether we're looking at low acuity individuals using, let's say, Fitbit or wearable devices in order to track and monitor health, to individuals with a little higher acuity that may be utilizing some over-the-counter glucometers that you can find at a CVS, or even a higher acuity individuals where physicians are actually deploying out the blood pressure cuffs in the home, the scales, even a glucometer, a pulse ox, and then having that information then brought back into the provider's view inside of the electronic health record that can run the algorithms to determine a level of risk, and then have the appropriate protocol to intervene. So if someone is, we're looking at an individual, let's say, that is out of post heart surgery and at home and is starting to gain weight, can have the indication back to the provider, and then they can notify the appropriate nurse in order to engage and possibly into a telehealth session. We're also seeing remote patient monitoring up into Health and Human Services, where individuals that are suffering from a co-occurring and physical health diagnosis, maybe they're suffering from a major depressive disorder and diabetes, so that the provider can then put the glucometer inside of the home, and then making sure the individual is testing their blood sugar and getting those results back so that they can look and treat that individual appropriately, maybe engage in a session that is needed in order to provide educational material, and really help to mitigate the risk of an individual having an episode by the use of remote patient monitoring. So I think we're going to continually see more of these remote patient monitoring programs coming out. And as we know, the strong co-occurring physical and behavioral health morbidities and complexities, this is a way for providers to be able to care for that individual holistically by putting a remote patient monitoring device in the home to better treat that individual. So as we're taking a view of the current landscape, obviously there's been an immediate shift to virtual care. So like many organizations overnight, there was determination to take their face-to-face clinical service delivery model and move it into a virtual care. So that's been having a lot of providers and organizations having to quickly leverage technology in order to meet that demand and make that shift. As I mentioned before, a rapid evolution to telemedicine. So as there have been a number of different companies out there that have been doing telehealth or even kind of telecommunication services, many organizations have been looking at how do they expand that as an internal communication tool to externally. That has come with its own inherent challenges, as those platforms aren't necessarily meant for provider to consumer or patient care delivery. But there has been a rapid shift in a movement into leveraging technology in order to keep up with the kind of the evolution into virtual care. And then also talk a little bit about the patient and client and clinic feedback. So some of the best practices from a provider perspective, as well as from a client consumer, as it relates to scheduling, how to engage, and how to clinically document those virtual care sessions. So when we looked at a number of our client organizations, we saw that 62% are seeing the same volume or an increase. So while in early March, there was a dip in utilization of services, as the telehealth has been deployed, that has been steadily rising. So actually seeing a higher rate of utilization of clinical services being delivered now that virtual telehealth has been enabled. And really looking at the two distinctions, there's been a shift in the regulations around telephonic services versus video. I think those will roll back, be one of the first that roll back as we're moving through this crisis. and telephone or the video services will be the ones that will be here to stay. Also seeing an increase in the no-show rate, which is a good thing. So individuals and consumers are feeling more comfortable around the use of telehealth, the previous barriers around social determinants of maybe transportation, maybe childcare coverage, essentially have been removed to an extent by the use of telehealth. And then also, clients and consumers are looking at how do they mobilize virtual care. So how quickly are they moving into that model, into that manner, what the considerations they need to make from a staffing perspective, from a scheduling and billing perspective, from a consumer engagement perspective that allow this program, this virtual care program, to be successful. So as we look at the future of behavioral health, again, we'll say to continue to see evolving into video. Having that personal connection, at least through a face-to-face engagement with an individual provider, is really impactful. We're also, I think, going to continue to see that the preference for care by both the provider and the consumer are going to be through video and telehealth. It's going to be very hard to get the horse back into the barn, so to say, when a lot of the funding as well as the regulations have been allowing for virtual care to be delivered, specifically in our health and human services community. I think that providers are going to see the value and benefit of being more efficient with their time, as well as seeing engaged individuals through a telehealth session will allow them to continue to deliver the care and services to their populations in a much more efficient and streamlined manner, as well as safe. And also believe that the consumers are going to continue to like the preference of having virtual care based on the convenience. I don't think that it's going to be a broad brush. Everyone is going to continue to do that, but I think in certain circumstances, there is going to be a real value of continuing virtual care into the future. And then there's going to be a number of best practices that are going to continually being developed and deployed as we're learning forward in this endeavor. So whether it's, what's the best way to the best practice from clinicians that are utilizing telehealth technology in order to have the best possible experience for the client, or even clients as far as what's the best way to engage individuals, to remind them, and even the best practices of the kind of the environment that they're being deploying out telehealth and engaging directly within their environment, their own environment. So remaining behavioral health. So what problems can telehealth solve? So looking at additional use cases, I looked at a number of them earlier in the talk, but we're going to continue to see. There was even, there was public health has the when they're looking at contact tracing, they're looking at direct observation therapy. I think public health is going to continue to see the growth and use of telehealth. Virtual urgent care. So as programs are allowing for this digital front door, looking at unique and innovative ways to allow individuals to step into care, and using digital technology as a way for a first point of access for individuals, I think is going to continually taking on momentum. Also expanding capacity across state lines. So as provider organizations are looking to share capacity and are looking to access providers or even other specialty providers, as the regulations have been relaxed, I think that providers are going to be able to share their capacity across regions or parts of the country, which is going to make it even more appealing for providers to stay into a virtual care, as well as organizations that would be able to access providers more easily and readily in order to deliver more comprehensive care. So thinking about CCBHC, when organizations are partnering, let's say with primary care, medication-assisted therapy, telehealth can be a way to bring those providers together under a CCBHC type model in order to deliver a comprehensive whole person care. So when we looked at one of our clients, the Jewish Board in New York City, right at the epicenter of everything that's been going on from a COVID-19 perspective, they had a primary use case around virtualizing their provider practices as there was the stay-at-home order and shutdown order was put in place. Previously, they only had a set number of providers that were delivering telehealth, mostly MDs and nurse practitioners. They were using a business-to-business telecommunications model, not integrated into the electronic health record. But then during the telehealth, during the COVID response from their organization, they had to go overnight, so 100% of their services had to be delivered virtually. They were used in other outpatient and residential programs, and they quickly realized that we need to have a solid provider experience in leveraging a telehealth application that was integrated directly into the electronic health record. So this is where Jewish Board and Netsmart partnered from a telehealth perspective to deploying out Netsmart's telehealth application directly within the electronic health record, because they're seeing that this is a modality of care that's here to stay as a telehealth perspective, and looking at a solution that will scale their organization in a HIPAA compliant as well as an integrated manner in order to ensure that clinical documentation and billing are directly aligned, and that creating a good provider experience as more and more services are continually being delivered virtually into the future. So some of the challenges they found in the solutions was equipment for staff and clients that needed to ensure that they had a solid infrastructure for supporting their providers who are working from home, as well as looking at telehealth for individual clients and consumers using the appropriate devices. Having native iOS and Android apps help, as well as being browser agnostic. So whatever type of device that the client or consumer is using, they're able to utilize telehealth. Also, the EHR for integration for scheduling and clinical documentation and billing was really important to the Jewish Board, so that they can have this compliance as well as the efficiencies that their providers and clinicians would need in order to scale the virtual care. So they went through leveraging best practices, clear workflows for training and documentation, so updating their information for providers so that they have a clear understanding of how these sessions are going to work, and then moreover the kind of the operational side of how to manage a virtual care practice. Also, they had to pay special attention to the support models that they have for staff and for clients. So as their individuals are having questions regarding how to utilize telehealth, utilizing the equipment that they have in front of them in order to deliver the services, having the support infrastructure to be able to support those questions as they're coming in. Also, the Jewish Board has always been laser focused on security, but looking at cybersecurity now that they are enabling their providers to be delivering care and utilizing applications at home. So ensuring that the security and from both the consumer and for their providers was taken into consideration as they're deploying out the virtual care strategy. And of course, we're so happy and fortunate to be partnering with the Jewish Board across all of their programs and technology needs, but especially as being able to respond and be with them during this time of crisis across their organization. So with that, I'm going to land the presentation and open up for questions.